Mr. Shakir, from what you told me, I think you have this renal stone. This renal stone is it's kidney stone. There are stones inside your urinary system, and this is blocking the flow. And this is a very serious condition. So I will refer you now to the hospital by ambulance. Doctor, I cannot go, doctor. I have meeting. I can't stop, go to the hospital now. You must go because this is very serious condition. You should go, and if you don't go, I'm afraid you will die. Oh, doctor, is this serious? Is that serious condition, doctor? Of course, it's serious condition. I'm telling you that if you don't go, you will die. So it should be serious condition. So you will go now, okay, and I will refer you to the specialist within 2 weeks, and you should take more drinks and if drink more fluid, and don't forget to do some urine stick analysis and CT scan, and drink more fluid, and I will give you treatment called calcium channel blocker, nifedipine. Side effects: flushing, 20 milligram QD, and alpha blocker, tamsulosin. Side effect: dizziness, zero point 0.4 milligram to facilitate stone exit. And to prevent further stone, increase fluid intake, decrease salt, decrease amount of meat, decrease oxalate like chocolate or nuts or rhubarb, and decrease the rich food of uric acid like liver and kidney, and drink regular cranberry juice. This is very good, and maintain calcium at normal levels. And if the stone turned out to be uric acid stone, you will take allopurinol. If it turned out that it is calcium stone, we'll give you thiazide. And if it's oxalate, you will take calcium citrate, okay? And also, if you ever have any poor stream, any high temperature, if the pain not relieved, you should come back to me, okay? So, doctor, I will go now to the emergency? Yes, you will go now. I will call the ambulance, and I will refer you to the hospital. But doctor, I told you I have meeting. I just want painkiller so that I can attend the meeting. No, you should go now. You should go now, and you can't go to the meeting. If you go to the meeting, you will die. Doctor, I can't. I will come tomorrow. I don't care if I die. Well, in this case, please just sign a form for me. It's called discharge against medical advice, and you can come back tomorrow. If you change your mind, you can come back. Okay? Okay, doctor. That sounds fine. Okay. 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 Thank you. Bye.